For today's daily dose, we're gonna have an image of the day. So as you see here, this is a young female, and she's coming in with ear pain. She said she just got a helix piercing, and now her ear is red, it's swollen, it's very painful to touch. So what do you think this is? Drum roll, please. If you said perichondritis, you are correct. Now what this is really just an infection of the external cartilaginous area of the ear. These particularly are at very high risk of being infected with Pseudomonas. Pseudomonas, that's a big thing you have to remember for this. Now on exam, you want to go ahead and palpate the ear. There might be an area of fluctuance indicating an abscess that will need to be drained. And you also want to check for any embedded foreign body, like that piercing gone wrong. People at risk for this are obviously recent piercings, but diabetics, immunocompromised patients, any blunt trauma to the ear, or burn to the ear. Now remember, I said these things get infected with Pseudomonas, so we need to cover for that. Now the textbook teaching is that anyone with this infection should get a dose of IV antibiotics in the ER, and this is either with ciprofloxacin or levofloxacin to cover for that Pseudomonas infection. Now, most people are actually going to need to be admitted to the hospital for IV antibiotics. But we've all seen pretty mild cases, and if you think it's a mild case, you can go ahead and consult ENT. And if ENT agrees that outpatient is reasonable, you send them home on oral antibiotics and make sure that they have very good close follow-up with ENT to get this ear examined, and very strict return precautions should things start to go wrong. Now we want to remember these need to be treated very quickly because any of these infections that are left untreated or there's a delay in treatment may lead to some pretty severe ear deformities.